The night unfolds at Thompson Medical Center as Robert Thompson experiences a severe heart attack in his penthouse. His security guard finds him collapsed and immediately calls emergency services. Within minutes, sirens pierce through the quiet night as paramedics rush to save the 65-year-old millionaire known for his contributions to medical research. At the hospital, the emergency team springs into action. Dr. Chen leads the response, while Nurse Martinez prepares the cardiac unit. The atmosphere shifts when Thompson, despite his critical condition, demands no black medical staff attend to him. His lawyer, already present, threatens legal action if his client's wishes aren't met. Dr. Sarah Williams, the hospital's most experienced cardiac nurse, stands at her station watching the scene unfold. With 15 years of experience and multiple awards for patient care, she remains composed. Her colleague Jessica approaches, expressing outrage at Thompson's demands, but Sarah calmly continues reviewing patient charts. The hospital administrator, Dr. Patricia Moore, arrives to address the situation. She pulls Dr. Chen aside to discuss the legal implications while keeping Thompson stable. Meanwhile, other staff members whisper among themselves about Thompson's history of discriminatory behavior at his companies. Sarah notices Thompson's vital signs dropping on the monitor. She exchanges knowing looks with Dr. Chen. They both realize the next few hours will test not just their medical skills, but their entire team's professional integrity. In the background, Thompson's daughter Rachel arrives, visibly embarrassed by her father's behavior. She apologizes to the staff while trying to reason with her father. The tension builds as Thompson's condition requires immediate intervention, and Sarah happens to be the most qualified person on duty to perform the necessary procedure. Inside the cardiac unit, Thompson's condition deteriorates rapidly. His oxygen levels plummet as Dr. Chen and his team work to stabilize him. The hospital administrator debates with Thompson's lawyer in hushed tones about patient rights versus hospital policies. Rachel Thompson paces outside her father's room, torn between family loyalty and moral conscience. She approaches Dr. Moore, revealing her father's deep-seated prejudices stem from her mother's death at another hospital 20 years ago where he blamed the black attending physician for her loss. Sarah discreetly monitors Thompson's vitals from the nurse's station. She notices concerning patterns in his ECG that others miss. When she attempts to relay this information through Jessica, Thompson's lawyer interrupts, insisting on maintaining his client's wishes. Dr. Martinez, a senior cardiologist, arrives for consultation. He reviews Thompson's charts and agrees with Sarah's unvoiced concerns. The patient needs immediate intervention. The hospital staff grows increasingly frustrated as Thompson's demands complicate their standard procedures. In a twist of events, Thompson experiences a severe arrhythmia. His lawyer steps out for a phone call, and Rachel, witnessing her father's deteriorating condition, makes an executive decision as his power of attorney. She formally requests the hospital to provide the best care possible, regardless of staff demographics. The scene ends with Dr. Chen calling for emergency response, while Sarah quietly prepares the necessary equipment, knowing she might be needed despite Thompson's earlier demands. Thompson's condition reaches a critical point as his heart begins to fail. Dr. Chen discovers the standard treatment isn't working, and they need specialized intervention. Sarah is the only nurse present with experience in this particular procedure. Rachel confronts her father's lawyer when he tries to prevent Sarah's involvement. A heated argument erupts between them, while hospital staff rushes around preparing emergency equipment. Dr. Moore steps in, citing hospital regulations that override patient preferences in life-threatening situations. Sarah takes control of the situation, directing other nurses with precision. Her expertise becomes evident as she anticipates complications before they arise. Thompson, barely conscious, makes eye contact with her as she works. For a moment, fear replaces prejudice in his expression. The team successfully stabilizes Thompson, with Sarah's quick thinking proving crucial. Dr. Martinez later tells Dr. Moore that without Sarah's intervention, Thompson likely wouldn't have survived. Rachel overhears this conversation and breaks down in tears, realizing the irony of the situation. Meanwhile, Thompson's lawyer receives calls from media outlets. Somehow, word of the Millionaire's discriminatory demands has leaked. Hospital staff speculate about who might have tipped off the press, creating additional tension within the facility. The news of Thompson's discriminatory demands spreads through social media. Outside the hospital, protesters gather with signs condemning racism in healthcare. Inside, Thompson regains consciousness, discovering Sarah was instrumental in saving his life. Rachel shows her father the trending social media posts about his behavior. Thompson's companies start losing contracts, and his board members call for emergency meetings. His lawyer advises damage control, but Thompson remains silent, processing the reality of his situation. Sarah continues her rounds, maintaining her professional demeanor despite becoming the focus of media attention. Other patients express their support, sharing their own experiences with her exceptional care. Dr. Chen notices her handling the pressure with grace and nominates her for the hospital's Excellence Award. Thompson watches Sarah interact with other patients through his room's window. He observes her teaching a young resident, her patience with difficult patients, and her leadership during emergencies. His daughter catches him following Sarah's movements and recognizes something changing in her father's expression. The hospital receives an influx of messages supporting Sarah, including testimonials from former patients whose lives she's touched. Thompson overhears two nurses discussing Sarah's volunteer work at inner-city clinics, where she provides free healthcare education to underprivileged communities. Thompson requests a private conversation with Sarah. In his room, he struggles to acknowledge her role in saving his life. Sarah maintains her professional composure as Thompson attempts to justify his past behavior, citing his wife's death. She listens without judgment but firmly corrects his misconceptions about medical statistics and racial bias. Rachel enters during their conversation, carrying old medical records from her mother's death. The documents reveal a different truth. The black Dr. Thompson blamed had actually fought to save his wife against hospital administration's initial refusal to perform an expensive procedure. Sarah shares her own story of losing her father to inadequate healthcare in an underserved community. This sparks an intense discussion about healthcare disparities. Thompson's defenses begin to crumble as he recognizes parallels between his wife's story and Sarah's father's experience. The hospital board meets to discuss the media situation. They propose having Thompson and Sarah make a joint public statement, but Sarah declines, stating patient care isn't about publicity. Her refusal to exploit the situation for personal gain leaves a deep impression on Thompson. Thompson invests $50 million in a new foundation focused on healthcare equity. Sarah joins the advisory board while maintaining her nursing duties. The foundation announces scholarships for 100 minority nursing students annually. The hospital board attempts to capitalize on the publicity, but both Thompson and Sarah refuse to participate in photo ops. Instead, they focus on implementing practical changes, mentorship programs, enhanced training facilities, and partnerships with inner-city schools. Rachel discovers her father emptied his wine cellar to fund additional scholarships. She finds him in Sarah's free clinic, quietly observing healthcare disparities firsthand. Several board members threaten to resign over Thompson's new direction. He accepts their resignations without hesitation. Dr. Moore receives an anonymous donation to upgrade the hospital's diversity training program. Sarah notices Thompson's subtle smile when the announcement is made. Meanwhile, Thompson's former lawyer leaks documents to the press, attempting to discredit the foundation. The plan backfires when minority healthcare workers nationwide share their stories of discrimination. 6 months pass. Thompson's foundation expands to 5 cities. During morning rounds, Sarah introduces him to the first batch of scholarship recipients. They shadow her, learning both medical skills and patient advocacy. Thompson collapses during a foundation meeting. Sarah treats him immediately, discovering his heart condition has worsened. He refuses VIP treatment, choosing to stay in a regular ward. His roommate is an elderly black man who shares stories about civil rights struggles. Rachel finds her father and his roommate laughing together late at night. They're discussing plans to extend the foundation's reach into rural areas. The roommate, a retired teacher, suggests including educational support for students struggling with medical school entrance exams. National medical associations contact Thompson to discuss systemic changes in healthcare education. He insists on having Sarah present in these meetings, valuing her frontline experience over his business expertise. She proposes practical solutions that challenge traditional medical education structures. A new hospital board member questions the foundation's impact on hospital resources. During the heated debate, Thompson's heart monitor alarms. Sarah rushes to stabilize him, demonstrating the importance of quick response regardless of patient background. The media discovers Thompson's worsening condition. Reporters camp outside the hospital, but Sarah arranges a quiet transfer to a different floor. She finds Thompson reviewing applications from potential scholarship recipients despite his condition. Rachel confronts board members attempting to limit the foundation's influence. She reveals documentation showing improved patient outcomes since the diversity initiatives began. Thompson's former business partners spread rumors about his mental competency, claiming his illness has affected his judgment. Sarah faces criticism from unexpected quarters. Some staff members accuse her of using Thompson's guilt for personal gain. She continues her work silently, focusing on mentoring new nurses while Thompson recovers. One of her ments identifies a critical medication error in Thompson's chart, preventing potential complications. Thompson's condition worsens. He signs control of the foundation to a diverse board of healthcare professionals, with Sarah and Rachel as key members. During a late-night conversation with Sarah, he confesses his biggest regret: years wasted on prejudice. The first class of foundation scholars graduates. Thompson watches the ceremony via video from his hospital bed, where Sarah continues to oversee his care. Each graduate shares how the program changed their life. Rachel notices her father crying silently. Hospital statistics reveal significant improvements in patient care across all demographics. Other hospitals begin adopting their diversity model. Thompson's former business associates who opposed his changes now face public scrutiny for their discriminatory practices. Sarah finds Thompson working on his memoir despite his fatigue. He's documenting his transformation, hoping others will learn from his mistakes. When a famous publisher offers to sensationalize the story, Thompson refuses, insisting on keeping the focus on healthcare inequality rather than personal redemption. 1 year after Thompson's initial hospitalization, the foundation has helped over 500 minority students enter healthcare professions. During a foundation meeting, Thompson announces a partnership with 20 major hospitals to implement diversity initiatives. Sarah receives national recognition for her dual role in patient care and healthcare equity advocacy. She uses the platform to highlight systemic issues rather than her personal story. Thompson watches proudly as she declines lucrative speaking engagements to continue her nursing duties. Rachel discovers her father has quietly sold his vacation homes to fund additional scholarships. The foundation expands its scope to include support for minority-owned medical practices in underserved areas. Thompson's former board members attempt to reconcile, but he prioritizes working with healthcare professionals who share his new vision. Medical schools begin incorporating the foundation's diversity framework into their curricula. Thompson's transformation becomes a case study in institutional change, though he insists the credit belongs to Sarah and others who showed him a better path. Thompson's health takes a final turn. In his hospital room, surrounded by scholarship recipients, he signs his entire fortune over to the foundation. Sarah holds his hand as he shares final words of wisdom about judgment and redemption. At Thompson's memorial service, hundreds of healthcare workers share stories of transformation. Rachel announces the foundation's new name, the Thompson-Williams Initiative for Healthcare Equity. Sarah continues her nursing duties, declining the offer to run the foundation full-time. 1 year later, the initiative has expanded internationally. Sarah treats a patient who, like Thompson, initially refuses care from minority staff. She shares Thompson's story, sparking another chain of change. The final scene shows Sarah training new nurses, including Thompson Scholarship recipients. On her desk sits a photo of Thompson with his last written words: "Change starts with one person willing to learn."